group this morning. Let me introduce, for those of you who may not know someone who is here, from my far left, Beth Garvey, Special Counsel. To my immediate left, Dr. Howard Zucker, Health Commissioner Extraordinaire. To my right, Melissa DeRosa, Secretary to the Governor. To her right, Gareth Rhodes, who is Deputy Superintendent of Department of Financial Services and has been working with us in the chamber, coordinating COVID activities. It is a beautiful fall day today in New York. It's a great fall foliage weekend, you should know. We have a special I Love New York map that shows that. We were looking at it on the way down. Today is day 231. Today is Saturday. It's no tie day. Dr. Zucker didn't get the memo. Before we go through exactly where we are on the numbers, let's take a little bit of a step back if we can. It's important to keep our perspective in this situation. It's been so intense, and it's now been so intense for so long. What we do should be guided by what we've learned through this journey over the past 7 months. COVID has been a step ahead of everything we have done from day one. Literally, we didn't even know that it was here when it arrived. And as a nation, we were just wrong. The White House was pointing to China. It's the China virus, China virus, China virus. It was coming to California. It was coming to the state of Washington. But that's not where it came from. It came from the exact opposite direction. We're looking to the west. It came from the east. It had migrated from China, had gone to Europe, and the virus was coming from Europe, and we had no idea. They talk about, well, we did the China travel ban January 29th. Yeah, that's great, except it didn't come from China. It came from Europe, and there was no European travel ban until March 16th, which means January, February, March, the virus was coming, and we never knew it. And that's why when we had that first case, it just exploded because it had been coming for months. Well, nobody knew anything about these viruses. That's not true either. We had gone through this before. 2002 was SARS, then the swine flu, then MERS, then Ebola, then Zika, and now COVID. COVID is a zoonotic virus, a zoonotic coronavirus, like MERS and like SARS, from China, like MERS and like SARS, from a wet poultry market in China, like MERS and like SARS. So we don't have the benefit of saying, oh, who could have expected this? And then the mistake was compounded. The federal government abdicated responsibility. This is a federal crisis. I was in the federal government. When you say it's a 50-state crisis, you know what you're saying? It's a national crisis. When you have 50 states, by definition, that's national. And that's when the federal government steps in and the federal government takes an active role in the leadership. Here, the White House literally said, it's up to the governors. It's up to the states. Well, if it's a 50-state problem, how is it not a federal problem? And when did states become in charge of handling global health pandemics, right? And when you made the 50 states handle it on their own and frankly compete against each other, we couldn't even get enough masks and gowns going through this. We couldn't do enough testing. Literally, we couldn't get enough Q-tips to do the nasal swabs. Learn those lessons. And the worst mistake is still ongoing. And that was the denial of the problem in the first place. You will never solve a problem you're unwilling to admit. And this White House from day one has denied the problem and continues to deny the problem. The second mistake is dividing the nation. It's a virus. You only stop the spread if everybody agrees to work together to stop the spread. That's the only way you stop it. The division, by definition, aids and abets the virus. That's what division does. Look at the great irony. They talk about community spread. It's in the community, it's spreading in the community. What is the only way to stop community spread? Forge community. Literally, community of the common. That spirit where I'm going to work to help you and you're going to work to help me. The division aids and abets the virus. And it comes down to the mask. How this became a political symbol in this nation, I have no idea. And how you can have every scientific expert say, wear a mask. New York State was the first state in the nation to mandate mask wearing. Every scientific expert, projections saying 50, 60,000 people more will die because they don't wear a mask. And it has become a political symbol. Since when did basic humanity and saving lives become a political issue? Even after over 30 people get infected at the Rose Garden, you still want to say this is a political symbol? Now we're in the fall. The fall is a new phase. Well, what does it have to do with the seasons? It actually does have something to do with the seasons. And the scientists talked about this months ago, although the White House denied it. When you get to the fall, schools are reopening. Kids are coming back to college. It's colder outside. People are going indoors. You can't do the indoor dining as much. The fall itself has an effect on the spread of the virus. Again, there was denial, and now you're seeing the numbers go up all across the country, literally all across the country, which causes a problem for us on a parochial level because people from all across the country come here. And we have states on a quarantine list, and we have people in the airports and questionnaires, but it is an imperfect system. The state protecting its boundaries. So the numbers are going up all across the country. You can't play catch up with a virus. You know who said that? A.J. Parkinson said that. New York, one of the lessons we learned, look ahead and stay ahead, right? It's not checkers, we're playing chess with this virus. Look ahead and stay ahead. The fall, you're going to see an increased viral transmission rate. Fact, and it's happening. Look ahead to the winter, which is going to be the season of the vaccine. Hopefully, science finds one. But then you're going to have another really difficult, complex government issue. How do you administer the vaccine? But start thinking about it now. For the fall, we are going to deploy what we call a microcluster strategy. Well, there is no such thing as microcluster. You're right. There was no such thing as hotspot either. There was no such thing as a super spreader either, right? These are all post-COVID terminology. There should be a post-COVID dictionary for words that have come up only post-COVID. Microcluster would be in the dictionary, along with the other words. Up until now, what have we been doing? We have been targeting all our actions either on a statewide level, New York State on pause, we closed everything down, or we reopened on a regional level. Regions, downstate, upstate, Western New York, Capital District region. That worked fine, and frankly, it was our only option because we didn't have any more sophistication than that. We now have more sophistication because we've been at it for 7 months. So rather than looking at it on a state level or a regional level, or even a county level, or even a neighborhood level, we are now going to analyze it on the block by block level. We actually have data that is so specific that we can't show it because it would violate privacy. conditions. But we know exactly where the cases are coming from. Okay, so then change the strategy, change the framework, the template from a state to a region to a county down to the actual targeting by the block of the increase in the spread. So this is the Brooklyn zone, okay? The blue dots are actual cases. So if you see the concentration of cases where it's most dense, that became the most specific targeted zone. We call that the red zone. A buffer area around the red zone that still has a density of cases, but not as dense as the center. That's an orange zone. And then a zone around that by density of cases, which is the yellow zone. That is how we are going to target going forward. So there's no more statewide, regional, literally block by block with specific targeting. We said all along, I designed this graphic. Nobody liked it. But, you know, I'm the governor, so I get 1 out of every 20 slides, even if the people don't like it. You open up the economy, you watch what's happening with the viral transmission rate spread, and if the increased economic activity raises the viral spread too high, start to back off on the valve. But subtle, sophisticated calibrations, not these states that go on, full off, full on, full off. Don't open and close. More sophisticated calibrations off the testing data. This now, microclusters says, and not just turn on the state or calibrate the state. Don't just calibrate the region. Calibrate now just those specific geographic areas. Target it and target your strategy down to that level of activity. It requires more testing, more targeted testing, and then you have to be responsive to the situations in that specific locality with mitigation measures for that specific locality, but it has the advantage of causing less disruption. If you have a problem in Kew Gardens, Queens, and that's your problem, then why affect activity in the rest of Queens, let alone Brooklyn, Bronx, et cetera, right? So it's much smarter, it's more effective, it's also less disruptive. To make it happen is the trick. You have to have refined detection, which is more targeted testing. You have to have mitigation measures for those areas that reflects why the virus is spreading in those areas. And then you have to do enforcement. That is how this works. And again, the devil is in the execution, not in the details. It's actually in the execution. Almost by definition, if you have a cluster, it means there was a lack of compliance. Almost by definition. If people are following the rules, the virus does not spread. That's good news. That's good news. If people are following the rules, the virus doesn't spread. You look at the situations where the virus spreads. It's always a lack of compliance, frankly, a lack of common sense. Sweet 16 party on Long Island with too many people, bars in the southern tier with too many people, then everybody goes to a funeral with too many people and it spreads. It's always a lack of compliance. The only answer to a lack of compliance is enforcement. So in these zones, yes, restrictive mitigation, back off on the valve, and then you have to do more enforcement because there was a lack of compliance. Otherwise, the cluster is not a cluster. It didn't exist unless there was a lack of compliance. Now we're talking about microclusters in Orange, Rockland, Queens, Brooklyn. The targeting and the more restrictive targeting is working. For example, you look at this is the Queens zone. In the orange area in the Queens zone, when we called it a cluster, it was 1.59%. Last week, 1.3%. So far, this past week, 0.4%. Okay? The compliance works, enforcement works, and reduction of congregate activity works. Also, you can now move the zone, reshape the zone, take certain areas out of the zone because we want the less disruption possible, right? The more people can open their business, the more people can go to work, the better. So we can adjust the zone quickly or the parameters of the zone. If you're at 0.4, frankly, you're in good shape, right? So the number came down, make the adjustment. And we will. This micro targeting idea has been, we've talked to all sorts of global experts about this and national experts, and people think it's exactly right. Again, you need the sophistication to do it. But the strategy is working, not just the microclusters, the whole statewide strategy is working. We have one of the lowest statewide infection rates in the country, period. You look at where the other states are going, you look at where New York State is, we are doing much, much better. Frankly, we're much more rigorous and disciplined than the other states. And our strategy, many other states, and our strategy is much more refined. You look at where our statewide numbers are over the past 14 days. We have been remarkably constant. 1.1 today. We were 1.1 2 weeks ago. And this is one of the lowest rates in the country. You look at our red zone rates. Now, red zones are what we define as red zones. And I'll show you that in a minute. These are within our 1%. These are our highest cluster areas, right? And they then are red zones because they are our biggest issues. Not absolute big issues, but relative to the state, they're big issues. Brooklyn was 6.6. That's almost 7 times the statewide rate, right? Brooklyn has made some progress, now down to about 4.9. 4.9, the statewide rate is 1. It's still almost 5 times the rate. Queens, 2.39, Rockland, 5, Orange, 6. Orange was at 24%. 24% is high in any state. That's not just a New York definition. And then you see the other statewide numbers. The New York red zone infection rate is lower than 34 states' overall rate. All right? What we consider a red zone, flashing lights, those infection rates in our worst areas are lower than the overall rate in 34 states. So when we say red zone, these are for us the high concentration areas. And we want to contain that because if you don't, that's where it's going to spread. Today's numbers, positivity in red zone areas 4.3, statewide positivity without the red zone 1.02, with the oversample 1.1. We also hit a record number of tests, 160,000 tests, which is the highest level of tests we've ever done. When you're doing that level of tests, think about that, 160,000 tests in one day. Yes, you get down to the block level. And then when you start to see a cluster, you oversample in that cluster, so you get even more data. Statewide hospitalizations is up 11. Discharges are actually down. Statewide ICU down 5. Statewide intubations up 6. And we lost 9 New Yorkers. They're in our thoughts and prayers. Beginning October 23, movie theaters outside of New York City will be allowed to reopen at 25% capacity with up to 50 people maximum per screen, with up to 50 people per screen. I don't know what that means, 50 people per screen, but it's 50 people. This is outside of New York City. Areas that are below 2% on their 14-day average and have no cluster zones. So this will be Long Island, not New York City, Nassau, Suffolk, Westchester, not Rockland Orange, not some counties on the southern tier, not green. Anything else?
Schuyler and Cortland with all as well. Schuyler are in the southern tier as well, and Cortland and Milwaukee with the college.
Okay. This microcluster approach, we're going to continue through the vaccine because this is not over until the vaccine. The vaccine, depending on who you listen to, and then depending on who you believe, should become available in December or the winter. That's a whole separate topic. But, and I want to speak to this tomorrow and the next day. When is it available? Do people think it's safe? Well, the federal officials say it's safe. All right. Might somebody question that judgment? New York, we're going to have a New York task force review that vaccine when it's ready. And if they recommend to me it's safe, then I'll recommend to the people of the state. How do you administer the vaccines? And let's not make the mistakes that we made in the beginning of this. Well, the states will figure it out. No, the states couldn't figure it out. They couldn't manufacture masks and tests and reagents. It didn't work. This is a massive undertaking. What is the federal government going to actually do besides say, here are the dosages, figure it out? Because that's not going to work. What's the state role? Where are the resources? Where is the funding? And you cannot make the same incompetent mistakes you made at the beginning of COVID. To give you an idea of how the scale of this, all our testing, we do more testing than any state in the nation pro rata, okay? That's why we have all this data. And then we can act on the data. Over 7 months, moving heaven and earth, 300 private labs, more testing pro rata than any other state. How many tests have we done to date when you add it all up? All right? I've done nothing for 7 months except COVID. To date, 12 million tests. Wow, that's a lot of tests. It is. Pro rata more than any other place in the country. What do you mean a test? I mean a test. Q-tip, nasal swab, bloop. 12 million. You know how many dosages of vaccines we would have to do? 40 million. 20 million people. And the projection is that the vaccine may require 2 doses. 40 million. If it's only 1 dose, it's 20 million. We only did 12 million tests in 7 days, moving heaven and earth, in 7 months, in heaven and earth, 800 testing sites, thousands of people. And a vaccine is roll up your sleeve. I'm going to put this needle in you, right? Unless they have a different, but it's an intrusive intervention. And you have to administer either 20 or 40 million. It's not as easily said as done. I'm chairman of the National Governors Association. we need to know basically who is going to do what. How is this going to work? And we need to know that now, because if you're talking about a vaccine in December, we have what? Matter of weeks to put this operation in place. We can have a plan. The plan is easy. Here's the plan: vaccinate everyone as soon as you can. Start with the greatest priority: senior citizens, nursing homes, essential workers. That's the plan. Okay, now how do you do it? Yeah, I got the first COVID plan. Everybody wears a mask. Okay, but now I have to get 20 million masks. So this is going to be a real issue, and I don't want to make the same mistake as a nation that we made. Last point, we know how to manage COVID. The doctor told us when he came to the house how to manage a virus when we had it. And he told us when the doctor came to the house in the old days, you have a virus, stay in bed, don't infect the other people in your house, in your home, don't get out of bed too soon, because then you'll go to work, you'll get them sick, and then you'll have a relapse, right? We know how to manage COVID, but we have to do it. This is just about doing it. And this is my personal opinion. Well, we have COVID fatigue. COVID fatigue is a real thing. It is a real thing. One day when they have time and they look back at this 7 months, there's going to be all sorts of mental health issues, PTSD issues, trauma issues. I mean, this is so stressful on so many levels. I don't even know that we appreciate it. It's almost for me that one of those situations where your adrenaline kicks in and you just go on hyperdrive and you're just getting it done and you're not even allowing yourself to feel and to process all the emotions because you're just so functionally oriented because of the fear. But 7 months of adrenaline is a long time. And the adrenaline wears off. And then you're really exhausted when the adrenaline wears off. And this wasn't supposed to be 7 months. I thought this was a few weeks when it started, right? Nobody knew, but it came out of the blue. What could it be? A month, 2 months? And here we are 7 months later. We're talking about another holiday season and what's going to happen to the holidays. I get the COVID fatigue. Beth, Howard, Garth, Melissa, they're tired. They've been doing this every day for 7 months. I would admit to fatigue. I get it. I get it on every level. But we don't have the luxury as a society of operating under fatigue. If you allow the fatigue to take over and you don't follow the rules, the virus will spread. It is that simple. We know how to control it. But you can't get tired when the virus isn't tired. The virus doesn't have fatigue. The virus is alive and well. And the virus is not letting down its guard. So neither can we. Compliance and enforcement. I know these are harsh concepts. I don't like to talk about compliance. And I don't like to talk about enforcement. Compliance, I'm like the nagging person, wear your mask, social distance. Enforcement, if you don't do it, then you're going to have a fine. If you don't do it, all sorts of people, nobody's happy with enforcement. I'm getting sued. I'm going to get sued by family members next. I get that people are tired of the enforcement, and I get that they're tired of the compliance. But And I would love to be able to say what some other elected officials say. Don't worry, be happy. Don't worry about it. Go out there, live your life, open your business. You'll be fine. And if you happen to get COVID, then don't worry about it. A couple of days in bed, and then you get better, and you feel stronger than you've ever felt before. Go ahead, live your life. We can do it. We're New York. Go ahead, enjoy yourself. Don't listen to these whiners. Worry, worry, worry. Go ahead. I would love to be able to say that. I would love to. You know the problem? It's not true. 217,000 passed away. It's not true. I've had too many conversations with too many people who have paid too high a price for the past 7 months. I've had too many conversations with wives of essential workers who died because they went to work to protect other people. I've had too many conversations with children who lost their father over the past 7 months because they were trying to do the right thing. It's just not true. It's just not true. We know how to do it. We just have to do it. And I know it's hard, but nobody wants to wear a mask. You know, you're only supposed to wear a mask at Halloween, right? Those were the rules. None of us have been here before. We wear a mask, we socially distance. I urge everyone to do it because to me, it's the exact opposite of harshness. It is out of love, and it is out of respect, and it is out of humanity. I want to make sure everyone does everything they can to protect each other. I want to do everything we can do to make sure nobody dies. That's what it comes down to. That nobody dies. Yes, it's hard. Yes, it's gone on a long time. But we do know how to do it. And we are doing it. And we are saving lives. And it will be over. We will get to a vaccine. And we will figure out how to administer a vaccine. Frankly, if the federal government doesn't do anything, we'll figure it out here in New York, like we figured it out for the past 7 months. We'll get there, but we have to get there. And we have to get there together. And we have to get there losing as few people as possible. And that's what this whole exercise has been from day one. And that's why, to me, every time I've clicked this slide, the last word is what it's really all about. Everything else is a way to make the last word a reality. And we have done it, and we are doing it, and we just have to continue to do it. Questions?
Yes, Governor, will public health restrictions in these clusters be determined by cluster approach, or will it basically be the same as the various restrictions on social gatherings, religious gatherings, et cetera, that we've seen with these recent clusters in Brooklyn, Rockland, et cetera?
You can have clusters, Zach, that have that require specific mitigation measures because they're presenting a specific problem. What's fascinating about this, and Beth is here, she's a lawyer, she's always counseling me about the privacy rules on health. But you can see it so clearly. I mean, when you can look at it block by block, you can tell sometimes there's an activity that is common to that locality that is causing the problem, right? I mean, we've literally, and then you add the contact tracing, we brought it back to Sweet 16 parties, to specific bars, to specific weddings. So if there are specific mitigation measures that make sense for a particular cluster, we would do that. Or you have the more generic congregate gatherings, but they can be targeted to that cluster. That's what's the beauty of it, geographically and programmatically. So you're just drawing a very tight circle, and not really circles because they go by the blocks, but you draw a very tight focus, bring it down within that targeted area, and you don't disrupt anyone else in the meantime.
This would all be based on the residence of the infected person, right?
Yes.
The listed address. So what do you do to mitigate a cluster that say, person from Brooklyn, person from Queens, Staten Island, all come and work in the same place, become infected, but there isn't an actual cluster geographically speaking?
Well, that's contact tracing. You can find that because you contact trace them back to the place of employment. They'll have a common place of employment, which, by the way, happens very frequently.
But are we talking about like just a couple of blocks or large swaths of area? Because if you're talking about like micro targeting and you're talking about 3 or 4 blocks, I mean, no one lives in a bubble. They can just walk a few blocks and go to an open store there.
Yeah, that's why we have the red zone, the orange zone, and the yellow zone precisely for that reason. Because you walk a couple of blocks this way to go to a restaurant, you walk a couple of blocks this way to go shopping. So we have the most intense restrictions, somewhat less.
So what, in terms of like testing and getting that like ramped up, have you thought about working with some of these synagogues in Borough Park and doing testing at those sites? Because
Yes.
I see that, for the city's testing, there's long lines. You don't see Orthodox Jews in those lines, that they're, maybe working with the community to get them tested specifically would be helpful.
We do that. We work with civic organizations, religious organizations. We've been working with churches. We've been working with synagogues. We'll go into a church and do testing. If they want us, we'll go into a synagogue. Did you have a point, Melissa?
Just to punctuate what the governor was saying, when we're looking at these things and we're able to look at them at the block level in the red zone, and then you've got the orange zone and the yellow zones going out. And so you're able to track whether or not actually at the heart of the cluster, if the cluster is starting to spread. And that's what's really important here. When we're looking at the numbers as of this morning, it looks like it's being successfully contained. So that's a way to know with this new strategy with the micro clusters. Is it going into the broader community? Is it not? And that was the importance of doing the rings and then looking at the positivity, not on zip code levels, but on these actual rings around to see if the margins are starting to be infiltrated by the virus or if we're being successful in containment.
So how about
Changes to the restrictions? Sorry, Dave. But when could we see changes to these restrictions? When do you think, if the numbers are going down?
Goes with the numbers. It's all about the numbers. Just follow the numbers.
So as you look at an area block by block, how small do you envision a red zone being? How small could it go?
Your block is going to be a problem. Yeah,
I
no,
probably-
just your block, but it's targeted for different reasons. You can go, well, our data goes finer, frankly, than a geographic zone would work. In other words, you could do a block, but a block is meaningless, right? You walk blocks this way, blocks this way, blocks this. So we can target it down to whatever geographic area makes sense. Is that what you're asking?
I'm asking, yeah, what do you envision as being the smallest red zone that you'll have in the city? Is it 5 blocks by 5 blocks? It's not a zip code anymore. It's a block or a couple of blocks. How small does it get?
It gets, that's a good question. It gets as small as you want to make it, that is operationally efficient, assuming you have that dense a cluster. That would have to be a very, practically, how do you wind up with a very high concentration in that small an area? It's normally somewhat more dispersed because they're going to the same restaurants or the same church or something else.
Governor, as the Kew Gardens cluster, you said the numbers were going down. I remember back in May and June, there were specific metrics and thresholds that were laid out to go on to the next stage. Do we have those thresholds in this microcluster strategy too?
We are developing them, but these are so refined that it's more just you can make a decision by looking at that specific cluster, right? You're right. When we had the phases for regions, we had metrics up so people knew when they were getting close, and it was very transparent. And I thought it was engaging of people, right? You can find out how you're doing relative to everyone else. with this strategy, we don't have those same benchmarks because it's so particular and circumstantial to that cluster. But you do know the numbers are either going up or going down, and you do know the state is at 1%, 2%, 3%. You really don't want to get higher than that. Did you have a point, Doctor?
Just say, it also depends on population density. If you have an area where you have some incredibly dense buildings versus a street where the houses are scattered about, and you have a lot of cases in that, suddenly that's a much more relevant area.
Anybody
So
else have a
what's
point? I'm sorry.
Okay.
Hold on 1 second. Did I violate any laws here? Privacy rights? Are they okay? I hate when they tell me afterwards. You just violated some rule.
So once a red zone is designated, has there been an increase in testing? Have you guys seen that?
There's an increase in testing, increase in enforcement.
And people are they going on their own volition, do you think, or is it like an outreach thing?
Well, it's always an outreach thing, right? There's no mandatory testing. You don't drag people in. It's increased testing, but it's more the enforcement because it's almost by definition. If there's a cluster, it means there wasn't compliance for whatever reason. People don't believe in it. People don't believe in masks, whatever the reason. The only answer to a lack of compliance is enforcement. I understand you don't want to do it. I don't want to do it either. But those are the rules to keep other people safe. So you have to have, and that's why I've been harping on enforcement, because you don't have a cluster unless you have a lack of compliance, which means you've heard it all, but you're not complying. It's not a public education effort, right? There's no person in New York who needs to hear you have to wear a mask. I will give you $10 for every person you find who says, I never heard that. You mean that the state wants you to wear a mask? I never heard the governor say you have to wear a mask. I never heard it. Never heard it. It's not public education. I don't have to say wear a mask. It's people aren't doing it. We know the congregate numbers for gatherings in a bar and a restaurant. It's lack of compliance, and the only way to address that societally is enforcement. Oh, that's so harsh. I know it sounds harsh. It does sound harsh, but that's what I said before. I think it's love. It'd be much easier for me to say, everything's great. Go ahead, go party. I'm with you, go party.
No, and just back to your question on the testing, we are increasing the testing in those red zones, as the governor said, but also in the orange and the yellow zones. One of the requirements, if you're in one of the rings around and the schools are still open, is that you have to test 20% of the in-school population. And so that's an additional step that we're taking so that we can find out through randomized testing in those zones around, is it starting to seep into the broader community? And as we've gone through this over the last 7 months, everything we've been doing has enabled us to be more nimble and more sophisticated. We now have the contact tracing app. As of yesterday, 570,000 New Yorkers have downloaded it. That's a tool that we're using. The increased targeted testing, the identifying of the red zones, orange zones, yellow zones, all of this is making it so we don't have to take draconian, broad-based measures where some areas of the country in Europe and throughout Asia have had to do, where you just say everything is closed because it's out of control and we don't know where it is. What the governor's saying is we now know where it is. We can track it. We know how broad it's getting. We're taking additional measures in the buffer zones around to ensure it's not spreading even further, with the hope that when people understand this, getting more testing, further refine knowing what it is, make sure the numbers go back down, reopen smartly.
If I get one statistic to add to that. So about a month ago, if you took just the red zones, just the population within there, we're doing about 1,900 tests a day. Right now, that daily average is about 4,000 tests a day, 4,300 yesterday. This is about 30% above what the statewide testing rate normally is. We test about 0.6% of the state population every day. This is about 30% above that. So this goes to the governor's point about oversampling, about really focusing resources. So testing has gone from 1,900 a month ago to now more than 4,000 every single day, just within the red zones.
Let's take one more.
Governor, about enforcement with an example. So on Monday, there's supposed to be a wedding in Williamsburg that might attract a lot of people from Rockland County. My understanding is that the sheriff in Rockland County has sent out some kind of a warning. What would you say about that? That's enforcement that may be an issue coming up in 2 days.
And enforcement in that matter is, which is what actually happened in this case. We received the suggestion that that was happening, did an investigation, found that it was likelihood that it was true. There was a large wedding planned that would violate the gathering rules. And Dr. Zucker signed an order saying you can't have a wedding that in these locations that is over the gathering line, gathering guidance. Is that, Beth, you want to speak to that because you know the facts better than I do?
Yes, so yesterday, Dr. Zucker did sign a Section 16 order. That order prohibits the mass gathering that was planned for a particular location in Williamsburg. It was outside of the target red or orange or yellow cluster zone. But the information that our investigation revealed was that upwards of 10,000 individuals were planned to attend. And so the order was actually served in conjunction with the New York City Sheriff's Department. That order was served last night.
And that order is
To prevent.
to shut it down.
Correct.
Do you know if that in fact?
The order was personally served last night. We have not had any feedback. An individual who served with a Section 16 order is then permitted to request a hearing to Dr. Zucker. So we expect we will hear about a hearing.
But the city is aware of it. We did it with the city. They're aware of it. I'm sure that they're going to have people monitoring it. Look, you can get married. You just can't have 1,000 people at your wedding. You get the same result at the end of the day. You just marry. It's also cheaper. Go ahead.
You said last week you can fool some people, but you can't fool the state of New York. And then the mayor the next day said there's some confusion about combination yeshiva childcare centers. Is someone getting fooled here?
No, there's a clear delineation. You can be a child care center, and then you're licensed as a child care center, or you can be a school, and you can be operating as a private school and under that license. But they are separate licenses. A licensed child care facility can operate within the guidelines, not a school. And you know what you are because you have a license. You're either licensed to drive by the state of New York, or you're licensed to drive by the state of Massachusetts or some other state. You know, when you look at your license, you're either a child care center or you're a school. Or you can have a joint license, but they both have clear rules, right?
Correct. So for anyone that doesn't have the OCFS license, they are not permitted to operate.
Okay, guys, thank you very much. Have a good day.